using the medial angle and a clock face to describe trochlear dysplasia. These 4 femurs were identified as representative, going from normal on the left to quite dysplastic on the right. The medial angle flattens as dysplasia intensifies. The medial angle is identified with a red arrow, and we can see that it can be measured using the same imagination that the Cobb angle requires. It can be measured and recorded. The study group postulates that the most depressed portion of the proximal trochlea is the point where the patella enters and exits during flexion and extension. It can be easily palpated on 3D models. It's identified with the red arrow. It's more difficult to identify in a photograph. We use a clock face to relate the entry point to the center of the trochlea. Here's an AP of a normal distal femur. The most distal parts of the medial femoral condyle and the lateral femoral condyle are parallel to the bottom of this slide. We call a line connecting these 2 points the bicondylar line. We palpate the entry point and represent it on a photograph of the distal femur with a red arrow. We make a line perpendicular to the bicondylar line through the most superior portion of the notch and carry it proximally to the trochlear ridge. Then we draw a second line parallel to the bicondylar line where this perpendicular ends on the ridge. We mount a clock face on this perpendicular line with 12 o'clock touching the proximal line and 6 o'clock touching the most superior portion of the notch. Then it is easy enough to draw a line from the entry point to the middle of the clock face. This is a 12-20 left femur. Here's another image that has to be centered in order for us to properly represent it. The entry point is marked with a red arrow. A line going up from the notch is drawn, perpendicular to the bicondylar line. Again, the clock face is inserted and another line drawn. This one is a 1:30 left femur. Here's a more dysplastic femur, centered, framed, clock face applied, a 2 o'clock left femur. And the most dysplastic distal femur we represent, centered, entry point applied, framework applied, clock face applied, entry point represented at 2:30. The clock face and the medial angle are 2 good tools for describing trochlear dysplasia.
While 3D printing is instrumental in the understanding of the patellofemoral joint, consider the neuromuscular patient. This 7-year-old girl has dystonia in both of her legs, meaning she has involuntary muscle contraction. Early development with this motor pattern has caused an unstable patellofemoral joint, which is causing pain and gait dysfunction. I colored the physis green here and added some gray dots at the center of the trochlea. The purple line represents the path of the patella as the knee progresses through flexion. By looking at the distal femur end on, you can see that the path of the patella is nowhere near the trochlea. This helps me greatly to understand the complexity of this anatomy and to try to figure out exactly how I'm going to reconstruct this knee. The dysplasia seen in this case is the result of a complicated interaction of muscle forces that are irregular and difficult to quantify. But by holding the anatomy in my hands and looking at it from different angles, I can begin to understand what led to this, and maybe things that I can do to reconstruct this knee so that there's a lasting impact on this young girl's life.